So we are here today with Professor Alan Kachalia. And Alan is a physician, a practicing internist at the Brigham. He's also a lawyer, and we are going to talk about the law and regulation and how these tools are used to help assure and improve healthcare quality. Alan, welcome. Thank you so much for coming.
It's a pleasure to be here.
So Alan, I want to start off sort of taking a big step back, and we're going to begin by thinking about the legal and regulatory structure in the U.S. What role does the law play in assuring that when I go see a doctor, when somebody comes to a hospital, that the quality of that healthcare is at least halfway good? What can the law do in that respect?
So I think there's actually three ways that the law helps assure that we have high quality or safe care in this country.
Okay.
The first is regulation. States or the federal government sets minimum standards for which a practitioner must meet or a hospital must meet if it wants to operate. The second is the liability system, malpractice. That's a system of accountability, and we can talk about more of that in a second. And then the third is when it actually creates financial incentives or penalties for hospitals and physicians and other providers with regard to how they behave and what they do. And the ACA is a classic example of that.
Okay. So they're all really important. Let's take each one of them one at a time, if you don't mind.
Sure.
So let's start with regulation. What do you mean regulation? Give me a couple of examples of the kinds of things that we do in the U.S. On regulation, and what do they have to do with quality?
So I think the classic example of regulation that people think of is you need to have a license to practice. Mm-hmm. So I think the idea there is that if a doctor is going to practice medicine, he or she needs to have met minimum training requirements. So the idea is when people are out there practicing, we know that they at least have a floor or a baseline level of knowledge that everybody will meet.
And who sets those standards of what is a minimum level of baseline?
It can vary in how they're set. Sometimes they're set by the states themselves, or sometimes they're set by the states working with the relevant kind of professional body, working with them to figure out what the standard should look like.
Okay. And so the state says, if you're going to be a practicing internist or if you're going to be a physician in the state of Massachusetts in the United States, you need to have, gone to medical school, done a certain amount of post-medical school training.
Correct. I believe in most states it's either 1 or 2 years. Okay. You actually don't have to finish a full residency to do it. I think in some states it's literally 1 year and then you can go and get a license to practice.
Who are other professionals in healthcare beyond physicians who end up usually having to meet a licensing requirement?
So it can include nurses, pharmacists, physical therapists. I think those are all examples of people who need to have a license or pass some kind of certification before they can practice.
Got it. So almost everybody who touches a patient sounds like in the U.S., in most states, maybe all states, you need some sort of a license before you can get involved in patient care.
That's correct.
Okay. So we've talked about licensing as one set of regulatory mechanisms. What else is there from a regulatory kind of thing? What about for hospitals? What about for others?
Sure. For hospitals, there are regulations that are set up around fire safety, for example, is subject to regulation, or how safe the building is it up to code so that it won't come coming down on people? So all of that is subject to regulation, just as is the airflow pattern in healthcare institutions, because sometimes you need isolation precautions and things like that.
Yep.
So all of that is subject to regulation. In some states, things like nursing staffing ratios are also subject to regulation.
If you look at hospitals in America, if I wanted tomorrow to go and build a hospital, set it up, and run it to take care of patients, what specific to healthcare would I have to do to make sure I could run a hospital in Boston tomorrow?
That's a great question. I'm not sure I know exactly all the people you'd have to interact with to make this happen. I imagine you'd have to work at least with the Department of Public Health, because they also issue regulations around what hospitals need to do.
Okay, so we have Department of Public Health. What about regulators sort of beyond? Things like Medicare, right? Medicare is the biggest payer of healthcare in America. Do they get involved in figuring out what hospitals their patients can go to, or can a Medicare patient go to any hospital he or she wants?
So one, Medicare does get involved in regulation. For you to receive payment from the federal government for Medicare patients,
Yep.
there are actually what they call conditions of participation that you have to meet.
Okay.
One of the common conditions of participation that people talk about is you either have to be reviewed by the government, accredited by the government, so they can say you're up to snuff with regard to all the standards they've set, or you can undergo what's called Joint Commission accreditation, where the Joint Commission comes in and reviews you.
Okay.
I think as long as you meet all of Medicare's conditions of participation, Medicare patients can come in to pretty much any hospital that they want and the government will pay. Now, there are certain regulations that can constrain the flow of patients, but those don't have to do with regulation on the hospital end. They actually do with it on the patient end, because some patients can sign up for either what they call traditional Medicare, which allows you to go where you want, or you can choose to sign up for something that they call Medicare Advantage, which puts you in a capitated or a managed care plan, which can restrict your movement.
So fundamentally, if you're thinking about who's regulating the quality of hospital care, Medicare has an important role to play in asking you to get either Joint Commission accreditation or getting accreditation directly from the government.
And they use the power of the purse to get people to follow those standards, because the Medicare business often tends to comprise a significant share of most hospitals.